a Black mother suffering from postpartum depression goes to the hospital and then dies. Hospital saying nothing. Mother cannot get answers. It's a secret. So we're going to help this family expose what's happening in this hospital. Let me give you some background. In August, Denise Williams, 29 years old, a Black mother of a 2-month-old and a 3-year-old, was rushed to NYC Health Hospitals, Queens, to receive treatment for postpartum depression. It happened, simple enough, right? Williams' mother, Linda Magee, called 911 because her daughter was not eating. The mother did the right thing. Let's put up a picture of this deceased queen. That's Denise Williams. She is now dead, and there are no answers from this hospital according to the family. Now, people are protesting. Just 48 hours after check-in, Magee received a call from the hospital thinking she was going to pick up her daughter. She received a call from the hospital that an autopsy would be performed on her daughter. It was the first communication the family received that Williams passed away. That's what her family told the city. A month later, now remember, they're trying to work with the hospital. They're trying to figure out, hey, do you have more information? What happened to our daughter? What happened with her inside of this hospital? And the hospital is not giving them the information. So a month later, the family still has no answers as to why this young lady died in the care of the hospital. The family also has yet to receive any autopsy report. A spokesperson for the hospital told PIX11 that they have been communicating with the family. The spokesperson said, and I quote, let's put that quote up. "We are committed to providing quality, compassionate, and safe care to all our patients, and we will continue to communicate with the family as appropriate." Full. Williams' death also brings light to larger national issues: the maternal mortality rate of Black women. According to the CDC, Black women are 3 times more likely to die from pregnancy complications than their white counterparts. In New York City, that number jumps to 8 times more likely. Black women in New York City are also far more likely to suffer from postpartum depression and are also less likely to receive treatment for it. This mother did the right thing. This mother saw her daughter was suffering, recognized it as postpartum depression, called 911. And when the ambulance got there, when the paramedics got there, they failed her too. So let me explain how that happened. Williams and Magee both requested that she go to another local hospital that they felt was safer. But the paramedics denied their request, said Williams' aunt, Charlene Magee. Indeed, studies indicate that differences in where Black and white women give birth in New York City may account for nearly half of the disparities in severe but non-fatal maternal outcomes. This is still a tragedy. The family said, "We don't want condolences, we want answers." That's according to Williams' aunt. "It's been 3 weeks and my sister has no idea what happened to her child." Think about the grief of this mother. I want you to pause on this for a moment, because we're gonna highlight this on Indisputable and we're gonna put it out there on social media. And we're gonna follow up on this story. This mother saw her daughter struggling. There's a new grandbaby here. The mother has a new grandbaby. Miss Williams has a new child. She has postpartum. Grandmother says, "I'm gonna go ahead and call emergency services so we can get you some help, baby." Okay? And then she's dead. Hospital refusing to answer questions. City is now starting to respond. Protests are starting to happen. Still no answers. Something doesn't fit. Jackson, what are your thoughts?
Well, My initial thoughts are that this is just further proof that our healthcare system continuously fails the people who need it the most. And that without the media attention that this story got, this woman likely never would have even been in a position, her family probably never would have been in a position at all to receive justice. And just those numbers, 3 times nationally, Black women are more likely to die from pregnancy issues, and 8 times in New York City just goes to show that profit is at the center of the industry. Less attention gets paid to those who can't pay the bills or who aren't insured in certain types of ways. And so, the hospital obviously doesn't want to release the records because hospitals keep extremely meticulous records of what they do. They don't want to release the records because either they were that negligent that they may not even have any good records, or the records show that they didn't do their jobs in some type of very obvious way. So, that's really all that this boils down to. If it wasn't about keeping themselves looking good, then this wouldn't be a problem at all.
Or preparing their stories, talking to counsel, getting their story together, right? At this point, speculation is warranted. They are giving no answers at all, okay?